with that being said, when my addiction first started, I didn't think I needed the help. I wasn't needing to get pushed into it. I wasn't at a point yet where I was ready for it, or my life had become so unmanageable to where, you know, okay, call up the insurance company, let me go in somewhere. Exactly, let me take care of it. Then once I was at the depth of my addiction, Medicaid was the only option that I had, because, you know, you become very impoverished from this disease. You lose everything emotionally, physically, financially. So with Medicaid being my only option, trying to make a phone call to, you could call 100 places. Sorry, we don't accept Medicaid. You're calling all the way to Florida. I'm sorry, we don't accept Medicaid. We can't take you. Do you have $1,000 that you can walk in with? I'm sorry, I just spent my last $5 to get, you know, some cigarettes and whatever I needed so that I wasn't, you know, sick. So for us, that becomes, I mean, for me, that becomes, you know, very conflicting, because, you know, I'm running out there trying to find money so that I'm okay in my drug addiction. I'm not thinking about, well, maybe I can save up enough, you know, to pay for it.
It wouldn't be a drug
Exactly, you know, so where it leads us to, and then the resources that are available, unfortunately, you know, are just not there for us. You know, drug court for me, you know, like has been said, helped me be able to get into a program. But without that, I've waited months upon months to get into places.
Wow.
And then once I got there, it was, how am I going to pay for it? Am I going to have to try to call mom and dad again? Well, mom and dad are sick of paying for rehab at this point, you know, once I got to that level. So what do I do now? You know, do I just fend for myself on the streets and continue to live how I was? Because there's not, you know, as far as I've looked into, many options when you don't have the money or you don't have private insurance. You know, Medicaid will fund you to go to outpatient. Well, I didn't need outpatient. I needed somebody to stick me in somewhere for 6 months and readjust every single part. The drugs were just a symptom. It was, you know, my attitudes and behaviors that I needed this program. I still need this program. That's why I'm still, you know, doing everything in it. But, you know, the resources that are available to people who are on the low income spectrum are pretty much non-existent at this point. A therapeutic community is a community in which, you know, they break down your bad behaviors to try to replace them with good ones. We all work together. Like they said, you know, they're all support. They all went through the program together. We have different groups that we participate in that allow us to point out some of the negative things, but also to reinforce the positive aspects that we see in people. So a lot of other programs that I've done which haven't been TCs, you know, they tend to sugarcoat things. You know, you do have a lot of downtime. This is really, you know, one-on-one with your peers and other people that have gone through the same situations, you know, have similar issues that you have. Not just the addiction, because the addiction is just, you know, part of it. The drugs are just part of it. It's, you know, the behaviors, our attitudes, our lifestyles, all the things that we went through, and being able to point those out in other people and actually discuss them and, you know, work through them is the biggest part of it. And I know for me, I really needed somebody who was going to tell me, you know, you're being a really big, you know, right now. I think you know, this is maybe, exactly, for lack of better words, this is, you know, maybe what you could do to fix it. Or, you know, we have conflict group where, you know, if you have an issue with someone in the house that you're living in, because it really is a family, it's a house, you're with these women 24/7 for, you know, 4 months, 6 months, 12 months, you know, really all dependent on what program you're in, to be able to say to them, look, you know, this is the issue that I have with you, or this is something I see that you're doing, and be able to actually work it out in a constructive way instead of the old ways that I always ran to, which was either using drugs or lashing out or getting arrested. And I mean, for me, it was beneficial because I needed to see those things. Nobody ever wanted to point them out to me before, and being here, I was able to, you know, get that kind of constructive criticism, and, you know, sometimes not so constructive from other people, but you need that too at points. I mean, I needed that little, you know, kick to be able to say, okay, this is what I'm doing, you know, in my life with my attitudes that wasn't okay.